Hello, and welcome to another episode of the Health Bridge podcast. I'm your host, Holly B. And as always, I'm thrilled to have you here. Today, I can't wait to introduce you to Dr. Alan Bauman. He is a leading expert in hair transplant surgery and hair loss treatment, as well as the CEO of Bauman Medical, which is his internationally renowned medical practice in Boca Raton, Florida. With over 28 years of experience in the medical field, Dr. Allen has dedicated his career to helping patients restore their confidence and self-esteem through effective hair restoration procedures. As a hair transplant specialist, he has gained a reputation as a leading authority in this field, and his contributions have been recognized at numerous national and international conferences where he's been invited to participate as a faculty member. Dr. Allen's practice is based on a patient-centric approach that focuses on understanding the unique needs of each patient and developing personalized treatment plans that deliver the best possible outcomes for each individual that he helps. Now, if you heard that intro and you're like, why do I want to listen to a hair transplant surgeon? Like, what's in it for me? Well, first off, hair loss affects so many people that you definitely know at least one person, if not yourself, who has struggled with this issue. So it gives you some insight into what they might be going through emotionally, as well as what might be indicated for potential treatment if that's something that the person cares about. But I want to also put out there that Dr. Allen is a bit unique in his approach. He really takes a full body, holistic, functional medicine approach to really diving into what is going on in the body on the scalp that could be contributing to this issue. And that really resonates with me because that's the approach that I've really had to take with my own health, and that's how I coach my clients. So that resonates with me on one level. On another level, this conversation is really important to me because I have a personal hair loss story, and it's not one that I was comfortable sharing for many years. And I'm at a point now where I think it's so important as a coach, as a health coach, to be very transparent about how my health has been affected, over the years with all the things that I've struggled with and managed and dealt with autoimmune conditions and chronic fatigue and stressful periods of my life. And hair loss is a big part of that. So I'm basically coming out on this podcast to talk about my story. And I'm hoping that it resonates with you in a sense that our health conditions aren't something that we should be ashamed of, but rather something that should be shared so that we can learn more and grow more and connect more with others. Dr. Allen is amazing. He has so much knowledge in this area, and he takes so many different approaches that regardless of whether hair loss is an important topic to you, you're going to find this fascinating if you like to listen to just overall health and even biohacking measures and anti-aging measures. So I promise there's something in this episode for everyone. And before we dive in, I do have a quick ask. I would love to ask you to subscribe and share this podcast. As I said before, everyone knows at least one person that is struggling with hair loss. So please take a moment to think about the people in your friend and family group who might benefit from hearing this episode, and please share it with them. Not only will it benefit them and give them new information, but it also helps this podcast grow, and it helps Dr. Bauman's message and services get out there further to help more people. So I thank you for that ahead of time. And now let's dive into this amazing episode with Dr. Bauman. Dr. Alan Bauman, I'm really excited to have this conversation with you today. I was telling you earlier when this topic first came across my inbox, I was ready to say, I don't know if that's going to be the right topic for my listenership. And then I realized, this completely applies to me and some experiences that I've had, as well as probably the majority of my clients. So I looked into you further, realized that you're very holistic oriented as well. And I was like, absolutely 100%. I need to talk to this person. So
Uh,
welcome to the show.
well, thank you so much, Holly. It's really a pleasure to be on with you.
So, first off, you are a hair expert. How, what got you interested in that in the first place?
Yeah, well, originally, I didn't think I was going to go to medical school and become a hair transplant surgeon. I really was focusing on plastic surgery and cosmetic surgery, and really the changes that I could make, in form and function in the human body using surgical skills. And my first mentor was a plastic surgeon. I was going forward through medical school and my internship residency, always with the interest in cosmetic procedures and treatments. But it wasn't really until I had met a patient who had had a hair transplant. Did I even think about hair transplant surgery? In fact, I just thought, like probably everybody else in the 1990s, that it was pluggy or painful. And, why would you ever want that or perform that? And this patient totally changed my perception of what a hair transplant could be. And, when something kind of crosses your path like that and really makes you question, your current set of beliefs, it required kind of a second look. And his I really would never have known it. He was a hair transplant patient, except it was revealed in his medical history. He was having, another procedure at that time, something cosmetic, and his hair looked amazing. It looked fantastic. It looked natural. And so we got into this conversation, probably 15 or 20 minutes long at most, but it was about how he chose his surgeon who was artistic and creative and how he traveled to have that procedure. And so he told me kind of in layman's terms, how single follicle hair transplantation worked. And to me, I had never seen a hair transplant performed or much less maybe even seen a good one. And so I was totally intrigued. And then the next thing I remember about that conversation looking back is how it changed his life. So socially and professionally, he explained that basically his life was never the same, that it was improved for the better in both of those ways. And it really opened up a lot of doors for him in terms of his career and his social life. And of course, now he was maybe married with kids, all of that business. And, I started to think about that. Well, hey, I'm going into plastic surgery. Maybe I should look into this procedure as something to add to the repertoire. And that's how I kind of got started looking into it. And of course, that led to, looking at textbooks and journal articles and eventually traveling to some conferences, which were plastic surgery, hair transplants, and combination things, and really just visiting physicians around the world who are performing this technique and technology and learning about it and learning, wow, this is like a powerful tool to really change people's lives. And so that's kind of how I got started in it. And the more I learned about it, the more I loved it, and eventually, the more I wanted to do it just 100% of the time. And so that's kind of been my life after my internship, residency, and fellowship training in hair transplants. I started my practice in Boca Raton, Florida. And that's where I am today, Bauman Medical Hair Transplant and Hair Loss Treatment Center, a quick 25 years later,
I I bet it
33,000
did.
patients later,
Yeah, and I bet it did feel quick because you're doing something that you're so passionate about. And what I love about what you're doing and what you have just said is that this is something that changes people's lives for the better. And that brings to mind that it's just there's such an emotional component to what you do because I guess because society is so focused on looks, whether that's right or wrong is not the issue. It just is what it is, right? And so much of our self confidence, for better or worse, comes partly at least from our looks. And when it's something like our hair, we just want to look normal. We want a good head of hair. We don't we lose our confidence to an extent when we're missing, when our recedes, when we're thinning, when we have bald spots. Can you talk about kind of that emotional aspect of what you see with your patients that come in, from start to finish?
Absolutely. I mean, we always say in the world of hair restoration that hair is a very emotional organ. So what you're saying totally resonates with me and what I've seen in my patients over so many years. And of course, hair is an important sign of youth and vitality. And it makes sense if you think about it evolutionarily. These are things that kind of help you make a snap judgment about someone from across the room, whether they're going to be a good mate. And of course, evolution is kind of geared towards that, right? Are they going to be a good provider? Are you going to be able to have offspring and propagate the species? And I think hair, whether you're looking on the male pattern hair loss side or even female hair loss, because it's such an important sign of youth and vitality, when it starts to fade, that's why we start to feel bad about it. And it's something that we had, it's not like a breast augmentation. Maybe you never had, breast size that large, but you want something bigger, or maybe it was big and you wanted it smaller, more natural. But hair is something you all had. Everybody had when they were born, pretty much. And if it starts to thin, then certainly it can affect your life. And we know, obviously, through science and research and surveys, that hair loss and hair thinning has a dramatic effect and can have a dramatic effect on quality of life. And so, of course, the flip side, when we improve our hair, we look good and we feel good about it. It's part of our natural instinct to groom ourselves. And what I remember in my psychiatry rotations from medical school, almost 30 years ago, is that, inpatient psychiatric inpatients, wards are filled with folks that don't take care of themselves. Like their hair looks crazy, they don't trim their nails, they don't take very good care of themselves. So it's actually a sign of mental disorder if you're not taking care of yourself in that kind of way. And so it's just natural. And even, primates will groom each other, each other's hair and fur and so forth. So yeah, hair is a very important item to us. It also is hair follicles are a very highly metabolic organ. It's the most highly metabolic cell population in our body. So of course it's going to be very responsive, and I'm sure we'll get to this, to nutrients and fuel and whole body inflammation and stress and things like that. And so it's an outward sign of our health. Now, sometimes we have control over it, sometimes we don't. But the good news is that we have a lot that we can do when it comes to diagnosing and treating the hair loss situation. And of course, the best thing
Mhm.
about my practice is that when we get the hair back and improve someone's situation, it's really a game changer for them in terms of their quality of life, and really, really, puts a smile on their face. And that's really truly the payoff for me over so many years, is getting a chance every single day to see patients who we've had great success in restoring and maintaining their existing hair, and to see what it does to them and how it makes them feel. So it's a lot of fun. It's a fun practice to have.
Yeah, it sounds very gratifying. I mean, there's, especially with so many of my listeners being in the chronic health space and having to deal with doctor after doctor after doctor and not finding, much help or much improvement. And I know that I think all doctors go into the medical field, or healthcare professionals go into the medical field with the intent of helping people. And that's not always under their control, but with what you're doing, you have such a great positive effect. It's just awesome. I love it. So,
Yeah, every day I'm
were you gonna?
blessed. It's truly
Yeah,
a blessing to be able to treat patients in the way that we do, and to have so many modalities also that we can kind of tap into. It's not just, surgical hair restoration that I was trained in, 25, 30 years ago, but so many new modalities as well. And I'm sure we'll get into some of those things as our discussion continues.
definitely. I want to touch on that shame or embarrassment around hair loss, because that's really personal to me, and I'm going to share my story in just a second. What you were talking about earlier with people appearing unkempt, or like they're not taking care of themselves. It's whether that's true or not, when there is hair loss appears that way, whether we acknowledge that we're thinking that or not, right? It's just kind of ingrained in the way we perceive another person. And I think that's where that kind of shame and embarrassment can come from on the side of somebody who's dealing with that hair loss. For me, So my health story starts a little over 20 years ago. I was in a really stressful, unhealthy relationship at the time. And this is way before I was connected to my body at all and knew anything really about health. And I started losing hair on the top of my head in a circle about that size. And it freaked me out. I didn't never had experienced anything like that before. And, I come to find out later that, of course, that was very stress induced. But I went to the dermatologist. I had some injections. It was treated as alopecia. It grew back right away. And it was what it was. It never came back until I believe it was either 2018 or 2019. Again, I was sort of in another stressful area in my life. I was feeling just rather depressed. I was in a depressive state. I wouldn't say I was diagnosably depressed by any means, but just kind of lost my way a little bit and didn't know where I was going with my life. And we happened to be visiting some friends in Kauai, and I think I got a little sunburn on my scalp. And we were flying back to San Diego, which I've always been happy to come back to San Diego. But in this particular instance, I wasn't. I was really sad to leave and sad to come home because it meant I would have to figure out my life, right? And or come back to confronting my situation. And my hair started falling out again in the same spot as it had before. And it was too overwhelming to me at the time to go to the doctor and try and deal with this. And I just let it go and let it go and let it go. And eventually I was working with a rheumatologist and finally diagnosing that I have lupus and, autoimmune issues going on. And by the time I finally went back to the dermatologist to check on things, the hair follicles were dead. At least that's what I've been told. And, I've been able, it was active and it was getting larger and larger, but we were able to stop that. Everything looks healthy, but I'm coming out on this podcast saying I have decent sized bald spot on the top of my head. And for a couple of years, I would say at least 2 to 3 years, it caused me a lot of embarrassment and shame. And I didn't feel like I should feel shameful about it, but I really did. And I was so paranoid that it was going to be seen. And I'm past that now. I'm able to talk about it. I'm coming out publicly on this podcast to, discuss this. And so while I'm okay with it and luckily I can hide it pretty decently, it still is noticeable. And I'm curious at this point what options there could be. I don't think it's something I have to get fixed, but it's something I would like to at some point. And so I'm curious to go down that road, see what experience you have with other patients that have dealt with this, and then kind of what some of those options could be.
Sure. Well, of course, I haven't seen you in person, haven't looked at the area in person, but what you're describing is a type of scarring alopecia. And what that means to your listeners is that the hair follicles are going to be replaced by scar tissue and are permanently damaged. And this is obviously very different than some of the earlier cases, let's say, of female pattern hair loss, where there's a gradual weakening of the hair follicle, but the follicle's still there, and we have time to rejuvenate. In cases like lupus, we're dealing with a scar tissue formation. So it literally is like an injury to the scalp, in inflammation that's replaced by scar. And if your listeners have noticed that they have these areas, obviously, if it happens suddenly, you have to rule out alopecia areata, which is another autoimmune hair loss situation, which may have been your first bout of hair loss, which was treated very successfully, it sounds like. Today, we treat maybe not as a first line with corticosteroids or injections as you were, but today maybe we would use something like PRP, platelet rich plasma, to reduce that inflammation and boost the follicle growth and regrow it. And we've had great success with that over time. But if the follicles are dead and gone, the skin will appear kind of shiny, less pigmented. It'll have kind of a glossy texture and color to it. It might appear thinner than the rest of the scalp. And so it might look and feel very, very different. And of course, it's not going to be growing any hair. So we would look at that area. In some cases, if it's progressing or we see inflammation, we may want to biopsy it, meaning take a piece and send it to the lab to look at it under the microscope for additional pathology. But unfortunately, if the follicles are dead and gone, first of all, the only way to restore hair to that area would be through a hair transplant. And that's where we take follicles from other locations on your scalp and implant them into the thinning or the balding or the scarred area. But here's the thing, if let's say the lupus is not under control, inflammation proceeds and progresses, it could reactivate. It could kill off other areas. It could actually kill off the transplants potentially in those zones. And so it's a tricky it's a tricky situation, not very straightforward. So we would definitely want to make sure that the underlying conditions, and this is why it's so important to take a holistic approach, but to look at all the underlying conditions to make sure that those have been mitigated and modulated to the point where we're not dealing with scalp inflammation anymore. And obviously, once that, let's say the situation is in remission, then we can go forward with some degree of transplantation, moving those follicles around and restoring. And we've had great success with that transplantation in certain types of scarring alopecia. And these are very successful for the long run, again, with that footnote that you've got to maintain good overall health.
And so somebody has lupus, for example, and like I have one woman who I've been chatting with, and she does periodically lose patches of her hair, and she's very hopeful that she can find ways of regrowing. They'll start to regrow, but then she might have another flare up and she'll lose some more. In a case like that, what do you recommend? Is it better
So,
to go about, maintaining holistic health and then using products to just help promote growth, or supplementation? Or is there, because it's still kind of a volatile situation, is that something that you can affect with transplantation or other methods?
well, transplantation is going to be our last resort. So let's back up and take a look and see what is her overall health situation. Because
Mhm.
what you're describing, patchy hair loss that kind of comes and goes, that's alopecia areata. And that's an autoimmune condition that fights against the follicles. The follicles stop producing the hair and you get a patch. Usually it's a round circle. Sometimes it can happen in childhood, sometimes it happens later on in life. For men, it can happen in the beard, for example. And obviously, patches on the scalp can be sometimes easily hidden and sometimes not so much. Autoimmune alopecia, like what you've described, alopecia areata, can progress into alopecia totalis, which means that you've lost now all the hair or most of the hair across the scalp. And or it progress even to alopecia universalis, which is the loss of all body hair, and it can be a very, very devastating condition. There are many prominent celebrities, both in sports and entertainment and such, who have gone through these problems and have had to deal with it. So an evaluation is the most important thing that you can do. So no matter what kind of hair loss, I guess that's the most important thing. No matter what kind of hair loss you have, you may want to visit your dermatologist, but you may also want to seek a second opinion from a board certified hair restoration physician. Because remember, dermatologists, yes, they can evaluate the scalp. Maybe they can even do a biopsy for you, but the whole armamentarium of treatments might be limited in your local derm's office. And so, as a full time board certified hair restoration physician, if you came into my office, we would look with several different types of microscopes, take some different types of measurements, get a very detailed medical history. And even in my practice, I have a full functional medicine department. So I have a functional medicine practitioner and his assistant, and we can take a deep dive into your medical history, blood biomarkers, even genetics if we need to, nutrigenomics, look at your DNA to see what you might be reactive to in your environment or in, let's say, your nutritional regimen, and look at different supplements, as you mentioned. So certain supplements and even taking care of your microbiome of your gut might be important to reduce that overall body inflammation and make sure you get good nutrients and fuel on the inside. And then what's going on at the level of the scalp? Is it truly a patch of alopecia areata, or is it something else? Because there's hundreds of different types of diagnoses that could actually be happening that could degrade the quality, the function of the follicles. And sometimes we need to do a biopsy or a microscopic dermoscopy to really dissect down and to figure out what's going on exactly. So the accurate diagnosis is critical to knowing what to do in terms of treatments. But let's just say we're looking at your overall health, your lifestyle factors, how you're treating your hair and scalp, making sure that you're not over processing it, for example, or exposing it to too many chemicals or too much heat, which could be damaging to the skin. We have ways to figure that out as well. As we said, nutritionals and the hair care products, but looking at different things like red light therapy and PRP, which is platelet rich plasma. These are regenerative techniques to try to holistically help the health of the scalp without medications or pharmaceuticals. But sometimes we have to resort to anti-inflammatory medications or topicals to shut down the inflammation that's hurting the follicles and to stimulate the hair follicles to do their business better. So there's a whole, gamut of things, I guess, when it comes to diagnosing and treating this kind of patchy hair loss. It's more than just, shoot before you aim type of thing. It's not like that at all. We really want to take a deep dive and figure out what could be causing this issue.
Well, you're speaking my language with going down the functional medicine route and really, really deep diving into all those different areas that could be adding to this. Is that standard practice for most people in your field, or is that more specific to something that you offer?
Well, I can't speak for other physicians, out there. Of course, as you may know, I'm one of about 200 board certified hair restoration physicians in the world. To my knowledge, I was the first to have a certified trichologist, full-time staff member. And her department is really designed to look at the scalp and make sure the scalp is healthy, that the scalp microbiome is not becoming dysregulated, there's not excessive inflammation. And so we're treating a whole host of different things well beyond the traditional just male and female pattern hair loss with that department. And I don't know another hair restoration surgeon that has a functional medicine department. Now there may be others that are coming online. I don't know. But it's been a big part of my practice for many, many years, doing a deep dive into the blood work, into lifestyle factors, everything from sleep to stress to nutrition, as we said, inflammation, looking at all of these different things to see what could be influencing the follicle. And the follicle is a very highly sensitive organ. Changes in your hormone status, nutrients and fuel, what you take in, and so forth. Mix and even your medications for other things could be influencing the hair as well. So that having been said, we really take a holistic approach, and I have over 35 team members here in my practice in a 12,000 square foot facility. So it's going to be a little bit different here than what you would get at a small derm practice, who's basically looking at lumps and bumps and, searching for precancerous things to freeze off of you and so forth. It's a little bit different than, someone treating acne. I'm not a dermatologist. I'm exclusively hair restoration. And that's my background is surgery. And that's why I think I've taken maybe a bit of a different approach, mainly because I've always been interested in health and wellness for myself and for my family and for my friends and my patients. I've been a part of the American Academy of Anti-Aging, for example, since the 1990s. And I've attended, dozens and dozens of different of those kinds of conferences, in addition to stem cell therapy conferences, cell surgical network, and things like that. And that's really where we get the latest and greatest information on what's coming next and how to use these modalities appropriately. And then we input them into the practice and see what works and how they can change lives related to their hair.
Absolutely. So it sounds like perhaps if somebody doesn't have access to you, for example, and I know that you also give virtual appointments and consultations. So I want to make sure everybody knows that. But, for somebody that needs to do something local to them, it sounds like perhaps they could sort of create their own holistic approach by seeing a number of different doctors, maybe a rheumatologist, their general practitioner, perhaps a dermatologist, as well as maybe a naturopath or a functional medicine doctor, and sort of start piecing these things together. Maybe less fluent than your team could do, but still could be accessible in that sense.
Well, I think you can certainly cobble some of that together. I mean, like many of our patients internationally connect with us first through virtual consultations, and obviously they can do that through the website. So whether you're down the block or across the country, we can have a virtual consultation. We can certainly look at your blood work if you've had that done recently. If there's certain biomarkers that we would like to see that you haven't had, we'll give you a list, so you can easily get those things completed. If we need to do a DNA test, for example, to look at metabolic pathways in your body that might be affecting hair loss or hair regrowth, or even a propensity to, let's say, get a better result from one treatment or another, we can send that out to you. even to the point where if you want to see if traditional treatments like minoxidil, for example, which, look, minoxidil is the first OG, if you will, the first medication FDA approved for hair regrowth, but not everybody responds to minoxidil. So looking at someone's DNA or getting a minoxidil response test out to you to see if you're likely to respond to a traditional treatment like that, or if you need something more sophisticated, a compounded version of minoxidil with other things that could be helpful. And usually it's a combination of things that makes hair regrowth work. And unfortunately, a lot of folks that are kind of out there DIYing it, they may not even know what their diagnosis is. They just say, "Oh, well, I've got hair loss." And we saw that, just recently, like, someone says, "Oh, she's got alopecia," but alopecia is just the general term for hair loss. So there's 100 different types of alopecia out there. Some are more common than others, you know. But the good news is that we can treat the vast majority of them quite effectively. And even in those cases where, as we talked about before, alopecia totalis, which could be severe patchy hair loss, we have 3D printed cranial prosthetics. Those are non-surgical hair replacement options. If you're battling, let's say, a bout of chemotherapy and cancer, for the next year or so, and you're going to survive it, you're going to do great, but your hair is you know, kind of taking a little hiatus. Well, there are things that we can do in the interim to make you look great, get you a Hollywood head of hair in the interim, and then on the back end, regrow that hair to the best of our ability with other modalities. So there's so many different things that are actually available out there. That's why you need someone and a team on your side to get to the bottom of the situation first before you just start, pulling vitamins off the shelf at your local, supermarket, or, talking to your stylist or salon, about a special shampoo that you hope is going to help with your hair. Not to put, I mean, look, shampoos and conditioners are important, and so is nutrition, but you want to, again, make sure you know what you're treating before you start the process. Or if something hasn't worked, let's take it a little bit further and figure out why.
Yeah, I love that approach. And I love that you can offer so much, even just a virtual consultation. That's amazing. Let's dive in just for a minute to the nutritional aspect and to the over-the-counter products, because that's where most people start when they start to see some hair loss and they start freaking out a little bit and they go to the shelf to see what's available there. Do those, and that was actually one of the questions that came up a few times when I asked my followers on Instagram, what questions do you have? They said, well, do the over the counter stuff work, like Rogaine or like biotin or like the other supplements out there, or topical? Like back the first time when I got the injections, I think I used a brand called Nioxin. I don't even know what's in it at this point. I haven't looked at it in ages, but that seemed to help the hair growth, stimulate the hair growth as a shampoo and conditioner. Maybe that actually did, maybe it didn't. I don't know enough about it to say, but is there any products that you recommend or definitely don't recommend? Some things that are somewhat effective, some things that aren't at all.
No, well, absolutely. And so, we know minoxidil is a potent hair growth stimulator. It works on most people, but not everybody. So that's certainly the ingredient in the over-the-counter Rogaine, and every other minoxidil that you see on the market is the same generic minoxidil mixed into propylene glycol. But unfortunately, a lot of those additive ingredients that are used as a vehicle for minoxidil can be very irritating to the skin. And also, what's interesting is that most people who try to use minoxidil on their own actually don't apply it in the appropriate way. Like, many folks I found, get it on their hair more than on their scalp. And obviously, it's not a hair treatment, it's a follicle treatment. So you got to get it onto the skin. You have to make sure it's not causing any kind of irritation and it doesn't leave a nasty residue. So, yes, minoxidil, but maybe not necessarily the over the counter. That's why a compounded or prescription version might be better. So, people that we know that certain people are not responsive to minoxidil, like they literally don't have the enzyme in their skin to convert the minoxidil that comes out of the bottle into the active metabolite minoxidil sulfate. And that's a genetic situation. So you could do a DNA test to see if you have that enzyme, if it's active or low, or you have a propensity for normal activity or low activity. But if it's low, then you're not likely to get a good response. So again, can we aim before we shoot with the over the counters? Maybe would be a good idea to do that. And the good news is that if you are a non-responder or low responder to minoxidil, that's not the end of the story. That's just the beginning. We can change the minoxidil component in the topical, add something to boost it up to make it work a little bit better. We can add maybe an oral minoxidil. That again, that's a prescription item to make it better. So it's not the end of the story. If you tried Rogaine and you failed, join the club. There's millions of people out there just like you, and we can fix that. Now, when it comes to the nutritionals and nutraceuticals, I guess I just like to kind of back up for a moment. If you're on a caloric restrictive diet, let's just say, and you're trying to lose those extra pounds, or maybe you've just converted, vegan, vegetarian, or something like that, and you're still kind of working on getting your caloric intake up to speed, your hair follicles could have a hard time producing a good quality hair fiber. So just the sheer amount of fuel that you're providing your body can make a big impact on the hair follicle metabolism. And, obviously the clear-cut case of that is, kids starving in Africa, they're nutrient deficient, they're protein deficient, they're completely bald. And even though they're, 1 or 2 or 3 years old, they have no hair. And so we see that very often, for example, in aggressive weight loss programs, whether it's bariatric surgery, weight loss surgery, or the new GLP-1 agonists like Ozempic, semaglutide, and things like that, where we're creating a decreased appetite and decreased caloric intake and slow, gut motility and so forth. And so what's happening is that you're shedding pounds, but you're also shedding a lot of hair, and that's not so good. So just the sheer volume and quality of protein intake is going to be very important. So a simple fix for that could be something like a collagen powder. And we have some under the Bauman brand, of course. There are other, pretty good ones that are out there on the market, but you want to make sure you have a good amount of quality protein intake if you're going to grow good hair. Even just during this conversation, if you're listening to this podcast for 1 hour and you have a normal amount of hair follicles on your scalp, let's say 100, 150,000 of them, you are going to grow 6 feet of hair within this hour. And so that's a
Wow.
very strong metabolic commitment that your body makes to grow quality. And so you better make sure you've got the nutrients and fuel, on hand, because otherwise your body will go into like a, emergency mode and not provide those nutrients to the follicle. It'll be used for more survival organs, let's say. And so other things that could, dysregulate the hair follicle function could be if you're iron deficient, right? And so that's also could be fixed sometimes nutritionally. Sometimes with supplementation, it's not so easy, but, good quality iron sources, whether it's leafy green vegetables or lean red meat, things like that. If you're deficient in that and you can tolerate it, great, do it. You want to be able to carry oxygen in your blood to the follicle, which again is going to burn that oxygen and fuel to make protein and make your hair. So those are just some basic things. We spoke briefly about probiotics. I'm a huge fan of probiotics. I think regulating your gut metabolism through the commensals, the bacteria that are in our bodies that we are symbiotic with, that help regulate not just, maybe our emotions, but also our nutrient and fuel metabolism and intake and so forth. Even our sleep-wake cycle can be influencing our hair as well. So those are, just some of the basic things. Biotin, there's been some debate whether you should be on biotin or not. And biotin is not a miracle hair growth medication. It certainly helps fingernail growth, which is, again, a dried keratin product of your body. It's much similar to your hair fiber. I think biotin would be helpful for hair quality issues more than, stimulating the follicle per se. But no discussion would be complete without talking about what I would consider nutraceuticals. So these are, items that could be, taken, for example, aside from just like regular B complex and the nutrients and fuel that you would normally need, nutraceuticals that have an effect on hormone balance, that have an effect on inflammation, that have an effect on circulation, things like that. And so there are some good nutritionals and nutraceuticals that have what I would consider strong clinical trial research behind them, like Nutrafol, for example. Everybody seems to know about Nutrafol. Recently, it's been made more national awareness due to marketing campaigns and advertising that you might see either on your phone or on your home TV and so forth. But I like Nutrafol. We curate it here in the office. Why? Because it has ashwagandha for stress. It has curcumin turmeric for inflammation. It has saw palmetto for your hormone levels. It's got some marine collagen in there and a host of other things that all together is basically like a salad in 4 capsules that gets you on the right path. But again, is Nutrafol going to work the same as like a medication? No, of course not. That's like on a little bit on the lower level, but it gets you going in the right direction. And I guess the same thing could be said for like low level laser light therapy, for example. Red light therapy devices today are available on Amazon and in Costco. But are those truly medical grade devices? No. And so you're not going to get as much of a response from those kinds of treatments and devices at home than you would an FDA cleared hair growth treatment like a turbo laser cap, which is a medical grade device that has hundreds and hundreds of lasers, high powered lasers that are going to get you a no side effect hair regrowth treatment at home in less than 5 minutes a night. So, these are the things that I think consumers need to be aware of is that it's almost like there's always a watered down version of the real thing somewhere, I guess. And sometimes you just have to like climb up the ladder because, plenty of my patients have started with consumer lasers or, simple vitamins, biotin supplements and things like that. And then, they need to go a little bit stronger. And, if you're not getting the results that you want, you don't give up your gym membership. You got to maybe hire a personal trainer or try a different regimen of workout, to get those results. So the same is true for hair.
Analogy. So I want to jump into, well, actually, I have one more question, and then I want to maybe do some rapid fire on some listener questions that I got.
Okay.
So,
Great.
right before we jump into that, what are some of the factors? Because most of my listeners are women. So, what are some of the factors that can lead to female hair loss? I know there's probably birth control or giving birth could be, or I don't know, maybe going through menopause, things like that.
Sure. Absolutely. I mean, if you think about it chronological in order, right? Hair loss can happen anytime after puberty. And the most common hormone imbalance in women of childbearing age is PCOS, polycystic ovarian syndrome. And it has a syndrome, right? Which means several different symptoms all together, not just cysts on the ovary, maybe even not, but it could be weight gain, excessive hair growth on the face, hair loss, things like that, acne. And so a lot of our patients are dealing with hormone imbalance at an early age in life due to PCOS. I think, like I said, it's the most common hormone imbalance of women of childbearing age. And then when they do get pregnant, give birth, your pregnancy hormones are raging, your hair is growing amazing. No, it's not from your prenatal vitamins, although, vitamins are helpful. When you give birth, your hormones crash. And then about 6 weeks later, you could undergo a significant shed. And that has to do with the amount of hair, it's a percentage of hair follicles that are in the growing phase versus the resting phase. And so everybody's going to shed a little bit every day as follicles turn on and turn off over the 100 to 150,000 follicles that you have on a healthy head of hair. And depending on the length of your hair, that could look like it's going to choke a cat or could just wash down the drain without you knowing it. So if you're having excessive shedding, you definitely want to start to measure your hair. And that's one of the things that we do in the office, measure hair quality and quantity, density and hair caliber, all in one fell swoop in a number of different ways. AI powered microscopes and a couple of other measurement tools that we use, like called the hair check. But certainly perimenopause, as hormones change again, and menopause, hormones are crashing or tanking out. You can have issues with thyroid, you could have issues with female hormones, and all of that can make you even more susceptible to what looks like male pattern hair loss. So you could be dealing with initially female hair loss, which is really just some gradual diffuse thinning across the top. And then later on in life, you could start to see a recession of the hairline. And so in those particular cases, when the hairline is receding, we need to take more aggressive action in those areas, whether it be with treatments like PRP. In the office, we also now have TED, transepidermal delivery system of growth factors and peptides. That's a non-injected treatment. But because of time is follicles, if you wait until the follicle's dead and gone, then the only thing that's going to fix it is hair transplant surgery. I think we mentioned that before. Another thing that we often see is traction alopecia. So women that use hair extensions or are using tight braids in the scalp or have worn some kind of a weave of some sort puts excessive tension on the follicles under the skin over time. That can cause the follicles to degrade quality and quantity of hair. And eventually they can be scarred and eventually die from that. So you have to be careful if you're using hair extensions. It's a Hair extensions are a quick fix. Don't get me wrong. They look beautiful, but they are addictive like cocaine. They, once you have them in there, you've got to, be careful. So for special occasions, it's okay. Certainly coloring your hair, same thing. You don't want to overdo it. Try to, less is more when it comes to degrading the quality of the hair fiber and the hair strand as well. So heat, chemicals can hurt the hair fiber as well as the scalp if you're not careful. Hair extensions causing traction alopecia. And so there can be a lot of things going on there that can disrupt women's hair on the scalp as well as eyebrows and eyelashes, which we handle as well.
What about wearing your hair back in a like tight ponytail or a bun? Like I come from the restaurant industry where you have to have your hair up all the time. Is that something that could also put too much stress and perhaps be worse for the hair than, you know, keeping it down as much as possible?
Well, sometimes we see like professional dancers, for example, ballerinas who always have their hair tightly pulled back, almost like excessively tight. So the point is that they're having it's so tight actually that they have to take a Tylenol or something to reduce the discomfort from having it pulled back. Those folks are certainly going to be at risk for traction alopecia. Now, if your hair is just kind of pulled back in a loose bun, I don't think that's going to be a problem. But, you never know. I mean, when it comes to traction alopecia, if you have thin, weak, wispy hair and you're a little bit prone to female hair loss, is the traction over time going to push it over the edge? Is that the straw that broke the camel's back, so to speak? That's why if you're wearing your hair like that, measurements are really important. So at the earliest possible time, get a baseline measurement. Even if you don't come back to us in a year or 2 years or 3 years, at least we'll know how good things were today. And it's, one of the things that hair does is it's a bit of an illusion. From across the room, a lot of women don't get a lot of sympathy from their dermatologists because you can lose 50% of your hair density without it being noticeable to the naked eye. So you could feel your ponytail going from this to this, right? Half the size, telling your dermatologist, "Hey, I've lost a bunch of hair. I'm shedding like crazy." And your dermatologist looks at you and says, honey, you're okay. You've got plenty of hair. You're not balding. Come back later or go pick up some Rogaine." And that's like the end of the story, right? That's terrible. You've already lost 50% of your hair. That's not good. That means you got to find someone to help you, someone else other than that physician.
Yes. All right. So I'm going to go ahead and just run through a few questions that I got.
Great.
Let's see. How often should you wash your hair? So I had somebody saying, should I maintain my every other day hair washing or should I slow down some more?
That's like how often should you detail your car? Now I know your listeners are mostly women, but I'm sure you've got some car fanatics there. And but here's the thing. I guess I'll put it in a really quick perspective. You know, our skin, the part that we see and some parts that we don't, it changes over time as we age. And no matter what human you are on the planet, the amount of oil production can change over time, for example. And the sebum on the scalp, that's our oil production, can go from significantly productive when we're in our, let's say, our teenage years or in our 20s, and it can get basically drier as we go into our later decades in life. And so just like that, the skin on your arm may need more moisturization as you continue on in life, or your elbows, for example. Your scalp might change. So your regimen of scalp care and scalp hygiene, which is what you're using to shampoo and condition, how much you use, how often you use, all of that can vary with time depending on your age, different variables about like your sebum production, right? The oil that your scalp naturally produces, your lifestyle. Are you, swimming and fishing and boating on a lake every day or working on a farm? Are you in a city with pollution and smoke and smog? Are you in a factory? Are you in an indoor environment? Do you work out once a day, twice a day? How often are you at the gym or at the pool or at the beach? All of these different factors play a role. Oh, and then how you treat your hair. Like, is your hairstyle require some kind of hair product or not? Do you use a deep conditioner or a light conditioner? Do you use a lot of heat when you style? Do you use a smoothing treatment, a straightening treatment, or God forbid, a Brazilian blowout treatment? What is your hair caliber and texture? Is it curly? You need more conditioning. Is it straight and thin and fine? You need less conditioning, right? So I just rattled off like dozens of different variables. So anybody that tells you there's one size fits all, you should wash your hair every other day, they don't know what they're talking about because they haven't even talked to you. So how do we figure this out? Well, you could go down the shampoo aisle, spin around with your eyes closed, and pick a bottle, maybe read it before you use it and see if it fits your lifestyle and regimen. You could try it, see if it works for you or not. But just remember that there are certified trichologists. These are people that study hair and scalp that can help guide you. And, these are the folks that are cosmetologists, which means they have beauty degrees, right? They've studied beauty. They may be hairstylists themselves. They have trichology training. The one that I've employed is amazing. Kimberly is incredible. And, she consults with people all day long. How much you should shampoo and so forth, and with what, and then with what kind of conditioner and for how long, and then what is the frequency of that regimen. And all of that it doesn't take into account at all if you have, God forbid, inflammation at the level of the scalp or folliculitis or dandruff, a dysregulation of your microbiome of the scalp, or something that needs exfoliation like psoriasis, God forbid. So these are all different factors that we need to take into consideration. So I wish I had an answer for how often should we shampoo, doc, and it's something I hear every single day, right? So there's no one size fits all. But I will say that I've designed my own shampoos that are good for people with thinning hair. So under the Bauman MD brand, you would find two different types of shampoo conditioner pairings. You would see the Boost, which it's very concentrated, kind of frothy in the shampoo and very light on the conditioning side. So it's geared for people with thinner hair, kind of like your Dioxin shampoo that you mentioned, but without the stripping of the oils of the scalp. And it also has hair growth properties, as caffeine, green tea, saw palmetto, other ingredients, and it's going to be chemical free. And then on the other side, I have a CBD containing shampoo and conditioner, which is called Soothe, and that helps soothe the scalp if, God forbid, you have some inflammation, irritation, or sunburn or something like that. So those are some of the things that, yes, we can shoot from the hip, but I prefer to actually look at it scientifically too. I know that
A
was a
longer
long
answer
answer
than
to
I
a short
expected.
question. Sorry for. So I don't know if that counts as rapid fire, but
No, that actually helps quite a lot because it gets us to think just more in depth about the situation and take into account all those different factors when we're figuring out what is best for us. Let's see.
my trichologist also does long distance consultations, by the way, through the office. So you can always schedule
Perfect.
some time with her if you're having some quandary as to what kind of shampoo should you be using and
Awesome.
how often.
Awesome. So let's see. What health conditions might trigger hair loss of the eyebrows? So I have somebody that I know through Instagram who lost just her eyebrows at a pretty early age, started in college, and they were completely gone by her 30s. Her head of hair is still there, nothing else. And she was always trying to figure out if that could have been an indication of something else health wise that's brewing under the scenes that was like perhaps a first sign, or could this potentially, and I know you can't say for sure, but could this
Sure.
potentially be an alopecia?
Absolutely. So, what are the things that could cause loss of the eyebrows? Sometimes we can diagnose it just by looking and seeing, is there inflammation or something going on there? Are there residual hairs left behind versus like a smooth, shiny location? Is it depleted density? Those are signs and symptoms that can help us. Is it depleted from the sides and working towards the middle? Could be a sign of thyroid imbalance. Alopecia areata can affect the eyebrows. Sometimes it's one side or the other or both. In women who are a little bit older in age category, so let's say in their 50s and above, who use a lot of moisturizers and sunscreen and makeup and things like that, sometimes eyebrow loss is associated with what we call frontal fibrosing alopecia, which is a scarring type of hair loss that affects the front hairline. And it doesn't happen in a weak, wispy way. It basically just erodes the hairline and the sideburns and also the eyebrows, and basically can leave you almost completely bare. So that skin looks kind of shiny and smooth and very thin, kind of friable looking. Very often, these patients will elect to get eyebrow tattoos or micropigmentation in that area. So, and sometimes it looks kind of flat and bizarre because of the way the skin tone has changed over time. So there can be a lot of reasons why you're losing your eyebrows. If you're in the early stages, sometimes Latisse, which is the eyelash growth medication, sometimes that works. Sometimes even minoxidil can help. Just a little Q-tip of minoxidil at night and in the morning, so twice a day. Don't get it in your eye, please. And we have other patients that need eyebrow transplantation, to restore their hair. But I guess the most common reason for eyebrow loss, to be honest, is plucking.
Mm,
So if you've plucked the
yeah,
eyebrow over time and time
yeah.
again, what is that? That's the traction alopecia that could occur. depleting the eyebrow density and quality over time. And many folks, who have been around for a while, let's say, in the maybe a couple decades ago, the thinner,
The
wispier,
90s.
wafy brows, yes, were in, and now it's a little bit more Kardashian-esque. And so if you want like a thicker, more like, let's say, Middle Eastern brow, then you're going to need to have some transplants to put some of that back in. And that's a common
Yeah,
procedure that we do. Yeah, eyebrow and eyelash
definitely.
transplants are some of my most rewarding procedures to do. I really enjoy performing those procedures. They're very intricate, delicate, artistic, and the results are beautiful. And not just for women, we also do eyebrow transplants for men too. Because if you start to lose the brows, then it starts to look less masculine and looks kind of weird.
Hmm. No, that's cool. I actually didn't think about eyebrow transplants. So it's basically done in the same fashion that you would, the hairline, but just done on the eyebrows. Yeah.
Correct. I mean, eyebrow transplantation today and hair transplantation of the scalp pretty similar. We're taking the individual grafts one at a time. There's no linear scar, no stitches or staples anymore. I mean, yeah, there's some people that continue to do that type of procedure, but we don't. We do this minimally invasive style, which is very comfortable. It recovers very quickly within just a matter of days. You're back in the gym. You can work out. The crusting is gone within a week, and you're basically back to normal. The other thing that I see in some of our female patients is cosmetic surgery, obviously. So brow lifts and facelifts can leave people with scars. Even minimally invasive brow lifts can sometimes leave some scarring in the brow zone. They may not even realize or remembered that they had a brow lift 10 years ago. And then all of a sudden they're receding a little bit. And then boom, you see like a little gap or opening there. That could be the opening where they use the endoscope. Let's say if you had an endoscopic brow lift procedure or facelift procedures in the days of old basically could obliterate the sideburn area. And oftentimes I'm asked to replace a female or male sideburn through transplants as well.
Mm. Then you mentioned micropigmentation. That's essentially like a tattooing technique, correct? And do
Correct.
you find that that can be viable for some people, or do you have any warnings against that? I'm curious your thoughts.
Well, you have to be very careful with micropigmentation, especially the eyebrow area. If you don't have any eyebrows and you're relying just on that two-dimensional either stroke, let's say, sometimes it can look very flat. I like to see a combination, to be honest, to put in the hair so that it has that three-dimensional look. And then, if you want to kind of adjust it a little bit or densify it, whether it be more hair or a little bit of pigment can go a long way. But we also use scalp micropigmentation oftentimes in female patients up on the top of the scalp. Sometimes women with dark, straight hair and light colored skin who have very fine caliber hair find themselves using powder and camouflage to cover these areas when they go out at night, for example, or to an event, a social event, let's say. And a little bit of scalp micropigmentation, which are basically tiny little dots placed superficially in the skin using a medical grade ink, using a medically trained technician can have a very positive effect on someone's self-image and self-esteem, as we said in the beginning of our conversation today, that they don't have to worry about like powdering or painting their head, to get coverage. And it's a very, very effective way to do it. It's not permanent, it does fade out over time, but it's not super expensive. And it's a pretty nice quick fix, to be honest, for even folks that have had previous transplants that just want to make a little bit more coverage happen, maybe without investing into the transplant process. I would just caution your listeners, not to do it so much at the hairline because it can look a little bit weird. So, keep
Hmm.
the scalp micropigmentation back in the areas where you already have some hair.
That makes perfect sense. So it's kind of a good in between option for somebody that might not financially be able to go all the way towards a transplant, but does need something for their self esteem to kind of fill in the spots,
Absolutely.
basically.
Absolutely.
Hmm.
Yeah. And don't go to an eyebrow specialist for scalp micropigmentation, please. And don't go to your local tattoo parlor. Please. That ink is
Yes.
not going to look good on your scalp. It's going to be blue. That's not good. It's going to turn blue. So you need to have it's a very specific technique. It's medical grade ink. It has a great quality to it. It fades out with time. The instruments are sterilized in a very particular way for the scalp. And so it's a, scalp micropigmentation, it sounds like a tattoo, but it's really not.
Yeah. It's a specialty field.
Yeah,
Hmm. Yeah.
for sure.
Awesome. So as we close, Dr. Bauman, is there anything that we didn't bring up today or any, last thoughts that you want to leave with our listeners?
Well, yeah, well, a few thoughts. Number one, in looking into the future, everybody wants to know what's coming next. One of the things that I did last month is I banked my hair follicle stem cells. And people say, well, what and how and why? And so I was able to actually have my hair follicles plucked without surgery, actually, enough biologic material plucked out and sent to a laboratory for evaluation. We got well over thousands and thousands of cells for cryopreservation. And so the purpose of that is to save and protect these stem cells, the mesenchymal stem cells or medicinal signaling cells that are in the hair follicle that could eventually be used later on for a variety of different regenerative medicine purposes. So, not just hair follicle cloning, which hopefully we'll have in a decade or two, but also tissue regeneration and repair. Sports athletes are getting that kind of a treatment today. Eventually, organ replacement, not just hair follicles, but maybe a kidney or a lung or something, could be designed from those banked hair follicles. And if I'm 80 years old and I need a new kidney, I don't want to have to use my 80-year-old stem cells. I would like to use my 53-year-old stem cells that I put in the bank last month. And so that's why I bank my stem cells. It's not an expensive process to actually perform it. It's non-invasive. It doesn't have to be a surgery, although it can be done at the time of a transplant. And the cost of banking it over time is less than the cost of a Netflix subscription per year. So I think it's a really, really cool thing that kind of hedges our bets and gives us something in the future to work with if and when we do have those regenerative medicine capabilities. I'm sure we're going to have, within a short period of time. So that's the first thing. Yeah, the future is here. So, time is follicles. So if you want to bank your hair follicles, let me know. We can help you do that. And then I would just say that for your listeners and for anybody that they might know who is having a hair thinning process or hair loss process, we talked a lot about how it can affect someone emotionally. So bringing up that topic is not always so easy, but I always like to impart some help to have that conversation with someone who has hair loss. And maybe it's something like this, like, hey, I noticed you talked about how stressed out you were last month, and I kind of noticed that your hair was looking a little bit thinner. Maybe that's a sign that it's time to, like, take some action, or maybe take a look at something in terms of your overall health. Did you notice that too? And so sometimes that's a nice way to kind of break open the conversation, not make it so much about how they're looking, but maybe how they're doing as a person holistically and how they're feeling and their overall health, which could, of course, hair follicles are an important sign of your overall health and vitality, as we've mentioned. And then, guide them to baumanmedical.com, BAUMAN medical.com. There's thousands of pages of information that I've written there over the past 25 years, hundreds and hundreds of hours of videos that people can watch about a variety of therapies and treatments and patient stories. And if they just have a question, they can go to baumanmedical.com/ask. They can ask any question and I'll get a response to them. But of course, a more detailed conversation can be had through a consult, and you can, start your journey there through, schedule consultation, and my team will help us connect virtually or in person here in beautiful Boca Raton, Florida.
I love it. And so somebody is just trying to figure out, is this normal female pattern hair loss? Like, is this just normal age related thinning versus is there something else going on? They can start with that question and go from there with you guys.
Well, I don't think there's anything normal about age-related thinning. Certainly, we're not going to go quietly into that night. We're going to fight like hell to keep our skin and our body and our brain and our muscles and our bone and our hair and our teeth to continue to function and everything else in between to function properly. So, I think the term age-related hair loss is going to be like age-related brain decline, which also, in my opinion, is not acceptable. We all know people who are 90 and 100 years old who are sharp as a tack, and so why can't we have that same health span, right? Continue to maintain that, throughout our years of life, not only just more, years in our life, but more life in our years in that way, and maintain our vitality, not just in terms of brain function and physical function, but improve that hair span also, which is the amount of time you get to spend with an amazing, thick, beautiful head of hair. Certainly, I fight every day to that.
I love that. So again, tell everyone where they can find you.
Yeah, so baumanmedical.com is the place to go for information. Like I said before, it has the info, thousands of pages of info, hundreds of hours of videos you can watch. Of course, you can find me on all social media platforms very easily, but baumanmedical.com is where you start your journey to improved hair and scalp health. And if you're out there, I look forward to helping you.
Thank you so, so much for giving our listeners a ton of great information to move forward on their hair journey. Thank you so much for being here.
Well, thank you for sharing your personal story, and it was great to be with you today. If your listeners have any questions that they want to have a follow-up, I'm always available. We can come back on and answer and ask me anything at any time, or maybe we do some Instagram live or something like that to answer even more questions that come in from what we've done today.
That oh, that would be super fun. All right, we'll schedule that. That would be amazing. Thank you so much.
My pleasure.
So going into this podcast, to be honest, did you have any idea that a conversation about hair transplant surgery and hair loss could be this fascinating? Because I didn't until I looked into Dr. Bauman's profile and how he goes about his medical practice. And then I was 100% convinced that this was a really important conversation to share with all of you. What I appreciate so, so much about his approach, and of course, I mentioned this in the podcast, is that he individualizes his approach to each patient, which is so important. And that simple concept is so missed in a lot of medicine. So much of medicine is standardized to different protocols. And if you aren't following along physically with that protocol, then professionals don't necessarily know what to do with you or how to help, right? So he takes just such an in-depth investigatory approach. And I love that. He keeps a sense of curiosity. You all know that I love the word curiosity because it keeps you open to possibilities. And that's exactly what he does is his team takes a approach with curiosity of how can we get to know this person's individual situation on a deep level to the point where we can change their life, and they don't stop when they hit a snag or don't find the answer that they were expecting. They keep investigating. And I just want to point out how rare that is. Unfortunately, I think it's getting better and better. We're finding more and more practitioners that are able and willing to do that and to step outside of the box that traditional Western medicine wants to keep doctors in. So I really appreciate that. And I love how accessible his practice is to patients across the world through online consultations, through setting blood work and tests through the mail, things like that. So I really hope that if you are struggling with this yourself, or if you have somebody that you know and love who is struggling with it, that you reach out to Dr. Bauman and his team. As he said, he is available to simply answer questions, to do those online consults. And, you know, whether our physical looks with our hair should be important or not, they are. And they do affect us and how we feel about ourselves. And so, it's really no different than somebody who has always had, screwy teeth. When they finally get their teeth fixed, they feel like a brand new person, right? They've got this new confidence because they feel like they can smile without being judged. And that same thing applies to hair and how we carry ourselves with confidence of having strong, healthy hair on our head. This is an important topic. This is something that can be helped. We have new technologies coming out all the time that will just make the process easier and more accessible. I'd be very curious to hear if you have your own hair loss story. If you would share that with me and with Dr. Bauman, that would be really amazing. I think it's healing to share our stories. Again, that's part of why I shared mine on this public platform, because I don't want it to shame me anymore. And I think it's important to be an example of that. So if this is something that you're working through yourself, if you're still in that emotional stage, use this platform to share your story. We are here for you. We're here for your support. and we're here to help in any way that we can. So please reach out to myself or Dr. Bauman and his team with any questions, concerns, and stories that you have for us. We'd be so grateful for you sharing. Thank you so much for listening to this episode, and I look forward to seeing you next week on our next episode.